Hello, we're here in Scottsdale, Arizona at the TED conference. We're here with Dr. Rick Jacoby, and we're going to answer some questions about the connections between sugar and cardiovascular disease. So Rick, that's the first question. Tell us about the connection between sugar and cardiovascular disease.
Well, there's a lot, and thank you for inviting me to this conference. Podiatry and sugar and cardiovascular disease are all one thing, basically. Sugar causes the inflammation of the lining of the blood vessel. Cholesterol sticks to that lining. That's what atherosclerosis is. And that's the connection between podiatry, peripheral vascular disease, and peripheral neuropathy. So these are all intertwined. That's why I'm here. TED is basically for Ted Dietrich. He started this industry in Arizona. I'm pleased to be here.
Cool, glad to have you. So tell us about I know you mentioned you're releasing a new book. We know everyone knows your first book, Sugar Crush, has been really successful. Tell us about your new book, Unglued.
Well, that's an exciting project. It's kind of got delayed the last couple months because I'm finishing up the FDA portion of what stem cells are, and that's a new thing. But the basics of the book is, and why it's called Unglued, because glucose, which is glue in Greek, and that's how this disease starts. It gums up the work, so to speak, for the artery, nerve, and vein. So Unglued will take us through all the technologies, all the pathology that is at this seminar, and devices that can clean out the artery, fix the artery, things that can prevent this disease in a much non-invasive pathology. This is an amazing conference.
Cool. I saw you walking the conference. There are a lot of vendors, a lot of really interesting innovations. Tell us about the innovations that you think are really impactful.
Well, I think it's just like the iPhone. That's what it is. It's cheaper, smaller, faster to the same technology. So diagnosing this disease is very simple, minimally invasive. That's an important point. And when you need to clean the artery out, it's now done in an outpatient setting, not in the hospital. A magnitude cheaper, no pain, in and out procedure, same day. The technology is here. That is here is game changer.
That's great. Well, thanks.
Yeah. Quite an innovation and a great day here in downtown Paradise Valley.
Well, thanks for joining us for this interview with Dr. Rick Jacoby, and thanks for joining us at the TED conference.